You're scheduled for a surgery or procedure that requires anesthesia care. Our highly trained team of anesthesiologists, resident physicians, and nurse anesthetists have developed a plan for your specific procedure. This video will provide more information on the type of anesthesia you will receive. Before your procedure, you'll be asked to review and sign the Consent for Anesthesia form. You will also meet your anesthesia team on the day of your surgery. They will provide any additional information about the plan, explain potential risks of anesthesia, and answer any questions you may have. Our number one priority is to keep you safe, healthy, and comfortable during your procedure. But we need your help to make the procedure go as smoothly as possible. You should have received instructions on eating, drinking, and taking medications. It's very important that you closely follow them. If you don't, you may be at risk for pneumonia and other severe complications, and your procedure may have to be rescheduled. You're scheduled for a cesarean delivery that requires anesthesia care. Our highly trained team of anesthesiologists and resident physicians have developed a plan for you. Your cesarean delivery requires neuraxial anesthesia, also known as spinal and epidural anesthesia. Your anesthesia provider will inject numbing medication close to the nerves in your back, causing a temporary loss of feeling and movement. Once we make sure you're numb to sharp pain, the OB/GYN team will begin your procedure. You'll remain awake, but will be as comfortable as possible. Being awake during the cesarean delivery may seem unsettling, but you'll be able to communicate with your anesthesia team and any support members. And compared to general anesthesia, neuraxial anesthesia limits the exposure of anesthesia to your baby. During certain parts of the cesarean, it's common to feel pressure. You may also experience nausea and shivering during the procedure, but these symptoms are easily treated. If for any reason the neuraxial anesthesia isn't working for you, we may administer more neuraxial anesthesia, provide additional pain medications, or even switch to general anesthesia to make you more comfortable. During anesthesia, we will dose your medication accordingly to make sure you're comfortable. After the procedure is done, you will feel numb for a few more hours. The most common side effects of neuraxial anesthesia are low blood pressure, nausea, and headaches, but these are easily treated with common medications. Very rarely, patients may experience bleeding, infections, and nerve damage with this type of anesthesia. Fortunately, this doesn't happen very often, and our anesthesia team will closely monitor you for any possible problems you may have. We know that anesthesia may seem scary, but it's safer and more effective than ever before. We've designed a plan that's specific for you, and we'll be with you every step of the way. If you have any further questions about your procedure, side effects, or potential risks, ask your anesthesia team. That's what we're here for. After this video, please review and sign the complete anesthesia consent form.